Welcome back to What the Fertility. Today's guest is reproductive endocrinologist Dr. Rachel Mandelbaum with HRC Fertility at their Beverly Hills and Los Angeles clinics. Dr. Mandelbaum has over 100 peer-reviewed publications and is the developer of Needle Free IVF, a brand new way to administer IVF medications using a subcutaneous catheter without having to do self-injections at home. Dr. Mandelbaum focuses on holistic fertility care and minimizing the physical and emotional burden for her treatment of patients. Today, we will be discussing how fertility treatment is evolving, not just to improve pregnancy rates, but to improve the patient experience as a whole. Welcome, Rachel. You are well accomplished. It was a mouthful.
Thank you so much for having me.
We are really excited to hear from you. This will be the first REI on the show for season 5. So
Ooh, exciting.
big shoes to fill, and I know several of my friends have actually started to hear about this needle-free IVF, so I
Oh,
think this
good.
will be a really good educational opportunity. But I think kind of to start, I'm sure everyone wonders, REI is such a subspecialized field of OBGYN. So what drew you to reproductive endocrinology and how did you get here?
Yeah, so I always had a passion for working with women. And it's interesting when you get to medical school, you kind of it almost feels like you get drawn into different fields from your mentors. So I thought I was going to go into ENT or plastic surgery, and then I was in my 4th year of training. I was like, "Oh my God, I just have to work with women. Like this is where I'm meant to be." So I pivoted and went back to, the drawing board of working with women, and that led me to OBGYN. And then I thought, okay, well, I really want to do something really surgical, and so I'm going to do gynecologic oncology, and I loved working with cancer patients actually. And then I discovered the fertility world, and really it was the laboratory that kind of drew me in initially. I loved, from a research perspective, just how quickly this field had moved and how much left there was to discover. I think I found that really, from a scientific perspective, really exciting. And then working with patients on their fertility journeys is an emotional roller coaster. And I think for me, I found that just so rewarding to be with people at their lows of lows and then their highs of highs. And it just really was the full package in terms of, for me, medicine is always just like more than a career. It's like a calling. And, when I'm texting patients at midnight, that's what brings you back is like, this is more than just a job. And so that's what REI or reproductive endocrinology is for me.
I love that. And I think, it is that specialized like desire to have a relationship with the patient when you go into OBGYN, because typically you're seeing them, for 9 months and then you're delivering their baby. And I think even more so with REI, because like you mentioned, once a woman comes to a reproductive endocrinology clinic, they're pretty much at their wits' end. They're like, I need help, and you're the only person that can help me. And I think I'm right in saying that you may have gone through a personal family building journey yourself. Is that right?
That's right, and that was towards the end of my residency actually, and so it gave me this unique perspective before I was really because in OBGYN we're training to deliver babies and training in gynecologic surgery, so it's not until you really go through 3 years of fellowship that you're in, strictly speaking, infertility world. And so it just gave me this, I think, unique perspective of going through it first and foremost as a patient before being a physician and seeing what that's like. Like I was very overwhelmed by giving all the medications, and I was like, how am I running a small pharmacy out of my house, and how am I overwhelmed by this as a doctor? And I can't even imagine what people who, aren't in medicine and haven't taken medications out of a vial before feel. So,
Yeah, no, absolutely. And I was so blessed during my experience to have a physician that also, I experienced recurrent pregnancy loss. And so my REI had as well. And so it was just a very different connection there, right? Because there's just a different understanding when you go through it
yeah.
than kind of teaching it or walking someone through it. So I guess I do have a question. So with your patients, I mean, did you share that with them that you had been through that, or how did that
Yeah,
work?
I'm a complete open book in all areas of my life, and so I share it with patients all day long. I mean, I think that that would feel wrong not to share it, right? It's why I do this. It's why I connect with patients, and I think it's kind of what has fueled my whole career passion. Even is trying to make this process more accessible, more comfortable for women. And so, yeah, I definitely share my own journey, my own family, everything. And I think it's very helpful to say like, okay, I know this is uncomfortable. There will be another side. There will be the flip side here, and this will all be worth it. And, to
Yeah.
help kind of be able to have that perspective to not just say you have to do this, but like I've been there, just
And
push
when you've
through a
been
little.
there, I feel like you identify the gaps a little bit more too, of like
Yeah.
when you're the patient, like, okay, what was missing in this experience that then now as a provider I can give to patients, which is really neat. And that was actually my next question, which you've already hit on, of just like, how do you make your patients feel supported during treatment? But I feel like just saying I've been in your shoes, I think it does, wonders. So, question for you. What do you think surprises patients the most when they're coming to you as like a first time patient, whether it's for IVF or just like a workup or IUI?
I think there's this notion of like coming in our office is like the last resort, right? And that doing IVF is like the solution. And I think it's very surprising for people to realize that fertility treatment isn't this like quick fix, that it can be this full journey once they walk into my door. And so I think that that's why I really urge people, and that's why it's so important that you have this podcast, and I'm so happy to be here, because I think that it's really educating people who are not in my office yet that like, okay, come in early, right? There's no time
Mhm.
that's too early, because if you're trying to get pregnant at 40, IVF is still potentially challenging then. And so I
Yes.
think that's like the kind of shock factor is like, what are success rates here? How for some people it's going to be a quick path, and for others it might be much longer. And I think kind of that shock factor of like, okay, we may have to do this a couple times, or because I'm very honest with patients. I think that that's the most important thing, is like transparency, and what are the success rates. How many times do we think we might need to do this, all of that. And so I think, understanding one, what a big role age plays in our fertility, which I think more and more people are talking about, and more women
Mhm.
know.
For both
Um,
male and female, I think,
yeah,
because sometimes, yeah, they just think, it's one or
yeah,
the other.
yeah. And that IVF isn't this like quick fix. Like age still plays a big factor in our
Mhm.
IVF success rates. And so I think that sometimes holds some.
I love that you share that. I have several friends, and that is part of our purpose of having a podcast. I think going to a fertility clinic is terrifying for a lot of women. And so hoping to have people on like you that can share what kind of goes on behind the closed doors of a fertility clinic, and having patients not as scared to go, just get an opinion. Like I
Yeah.
saw you do, like you did or are recently doing like free AMH checks, which is so cool. That's so
Yeah.
cool. So just kind of like getting familiar with your body, understanding what could be a solution for you or could be an option for you or maybe not. But just having those conversations, I think, don't have to be so taboo and like final, right? Like I'm going here at the end of trying everything myself. So I like that you.
Right. And I think if you find the right doctor, they're not going to push you into like doing IVF at this moment, but at least they can help you weigh your decisions of like, what do you gain or lose by pushing this off? But what do does this make sense with where you are in terms of your egg count, and how your AMH levels or your numbers or your quality or other, medical issues? How does that all fit into the picture here, in terms of potentially waiting or jumping in? And I think just having that other perspective. So basically, to come into our office earlier, and then, we can make a kind of group decision in terms of, what to do to create
Well,
somebody's
if people
family.
haven't heard it so far, you were very holistic driven, right? Like I can hear that. I can just hear that in your statements and some of your answers. So I mean, I guess why is that? Is that something that you just have always had like I guess like as a value personally, or did you evolve into this holistic approach? Because I do find it rare to find a holistic REI.
So, I mean, I guess growing up, my parents are both physicians. My mom is a primary care doctor, and so like her whole focus is on prevention of disease, and infertility is a disease. And so, I think that we have to kind of focus on all of those groups. And then my dad is a sports medicine physician, and so we've like my whole life is about optimizing quality of life and all of that. And so I think that when we approach fertility, it's a combination. On one hand, like IVF is the most, efficient treatment we have. It's the most effective option for a lot of people. But I think that we have to address all these other lifestyle things that can, add up all together to make a measurable difference. And so, I think just jumping straight to IVF or, and for some patients, that is the answer. Like I think I meet a lot of patients where, there's a lot of resistance towards IVF, and that's fine, right? And I will be very honest with them, like, okay, I think this is your best path forward. But I do think it is at the same time important to address all these lifestyle things, making sure exposures are at a minimum to environmental things, making sure somebody's eating a healthy diet, that we're addressing stress and sleep and all these other things that go into the picture of getting someone pregnant.
I love that you call that out, because I feel like on social media it's like either like a this or that. Like don't do IVF because you should be doing these things. And I love how you pair them together, because like you said, for some people that is their only option. And I think for the women when that's their only option, like, maybe it's anatomically, or maybe they have like balanced translocation, where like this is really your best bet here to forego a lot of grief, or loss of time. I just love that you call that out, because if I were to come into your clinic as a patient, I'd be like, okay, if she tells me IVF is it, like she really means IVF is it, right?
Yeah.
And the healthy lifestyle, the exposure to toxins, like you should be doing that anyways if you're going to, even if you're going to do IVF, to set your body up for the best success, whatever that method is.
Exactly.
I love it. Well, I think everybody's super interested in learning about needle-free IVF, including me. So, okay, tell us all about it. Like, what was your kind of aha moment of I need to figure out how to do this differently?
Well, I guess the first thing here is that I'm a huge needle phobe. Like I am a doctor, but I don't, like, my whole life it's been a struggle. Like as soon as flu season approaches and I need to get a flu shot, like I do it, but I don't enjoy it.
Even just a flu shot? This is
I
the irony.
I mean, I get it. I just
Yeah.
I don't enjoy it. And so when I was a OBGYN resident, I knew I was going to need to go through IVF, and that process was looming, and I was dreading it. I was like very scared. I was going to bed stressed, waking up in the middle of the night, having anxiety about giving myself injections. Like, how am I going to do this? My husband was also a resident at the time, and I was like, he's not going to be home to do it. I'm going to have to do it on myself. How am I ever going to do this? And it's totally like an irrational fear. Like, I know I could have done it had push come to shove. It's just, It caused me a lot of anxiety. And so then I ended up accidentally actually getting pregnant with my first son, which was very happy. And it kind of created this pause in
Your
what was
fear.
a moving path. And then I was like, okay, well, we have to make this better, right? I'm sure I'm not the only one that has this anxiety. And I happened to be working in a clinic with women who had type 1 diabetes, who had gotten an insulin pump, and they were so happy. And a lot of them said, oh my God, this is life-changing that I don't have to inject myself. And so because I'd had this recent perspective of, needing to go through IVF, I was like, oh my God, why don't we do this in IVF? Like, that's one of the only other fields in which, we're asking women who may have never given themselves an injection before to now give 30 injections in 2 weeks.
By
And to do it
themselves
on
at
themselves
home. Yeah.
and
This is
mix the
so cool.
medications. And not only that, but to have all of the feelings of infertility on top of that, right?
And have like doing it right. A lot of the, like making sure you're doing it right, because you're spending tens of thousands of dollars, and
Yeah,
the outcome is what you've wanted your whole life, right? Like there's just
totally.
so much
High
stakes.
stakes. Yeah, high stakes. So I kind of got this idea, and then was able to, because it was kind of delayed there, put it into action. So then when I went through IVF, it was between my 2 kids, and I was able to try it on myself before kind of trying it on a patient. So I did it in my own IVF cycle, and it was amazing. It really just reduced all my anxiety. And I think that what I realized is that for people where it causes anxiety, right? It's kind of a distractor. Like it consumes you a little bit, and you're not focused necessarily on like the the other things, right?
Well, what
Or
I've seen is like my really good friend, and you mentioned this too. She's now 41 and she just did her first round of IVF. She delayed by 5 years because she was terrified of giving the shots.
100%. And you know what? So this is just an aside, and then I'll
Yeah.
go back to that. So part of my passion is research. And so I was like, okay, we have to quantify this anxiety, because I know that if you talk to IVF nurses, they will tell you that some patients, this is a huge issue and a huge obstacle.
Yeah.
But when a physician walks in the room, patients are more talking about, like, okay, how are my follicles looking? How they're not necessarily saying, like, the injections for most are just a necessary part of the process.
Right.
So they're not focusing that precious few minutes on, oh, these injections are killing me.
Right.
But if
Because they
you
feel
ask
like
them
you
about
know
it,
that you have to do it anyway, so I'm just going to do
right.
it.
But if you ask them about it, you'll realize later, like, how much stress potentially and anxiety they caused. So I kind of set out to quantify this. So I just planted a survey in our waiting room over several months, and had just everybody coming into our clinic fill out this survey. The crazy thing was 2/3 of people had needle related anxiety that was like at the level of a phobia, like when you actually quantify a phobia. And there were 20% of those people who had significant needle related anxiety who had actually delayed coming into our office because of that. And
Yeah.
that's huge when we know how much of a difference time makes in female fertility.
Mhm.
So I try to communicate to physicians that we have more of an interest just in, okay, let's spare people some injections in doing this, because it is delaying patients from coming in our door. And
Absolutely.
we also know that the number one reason why this has been studied, even in um, countries or in situations where IVF is completely covered, like there's no out of pocket cost for women. We still know that more than half don't use all of their cycles, right? Even if they're not getting pregnant. And the
Mhm.
number one reason why people drop out of treatment is because of emotional reasons and the toll that being in fertility treatment takes. And
Yes.
so if we can alleviate some of that and keep people in treatment, we're more likely to get people pregnant and towards their end goal
Yeah.
of a family. And so this is really about success rates, actually. It's not just about making the process more comfortable, which is really important, but it
Right.
really is about patients meeting success as well.
Okay, so tell us how it works. I'm
Yes,
so
sorry. So
No, no, I
so I
appreciate that.
tried it on myself, and then I did a full clinical trial, because if you're offering this to women, exactly like you said, at a time when this is so high stakes, they're putting so much into this process, their first question is going to be like, okay, efficacy, is it as effective?
Yes.
So I did a clinical trial, and we were looking at all the hormone levels, making sure that the absorption is the same, that there was no difference from using needle injections, and it was, and that went great. And the women who used needle free IVF had really high, patient satisfaction. And we had a couple people who had done prior cycles with needle injections, and they all preferred using this system as compared to needle injections. Granted, there's a little bias there of who chose to be in the study, but
Yeah.
um, but I think what this really drives home is that we need this as an option, right? We need it as an option for women where giving injections causes anxiety or is problematic. So how it works is we use a small little quarter-sized device that we put on your abdomen when you
It's
come in
really
to
like
start
that
treatment.
small,
Yeah,
like a
it's really
little,
small.
because I'm thinking of like insulin pump when you
I
like
wish I
use
had one
those.
right in front of me to show
No, I
you,
mean
but
I
I
get
don't.
it. Okay, so you put it on your stomach.
Yeah, so you put it on your stomach, and there's all kinds of pictures on my social media, so anyone who wants
Okay,
to look
let's
it up
tag that
better.
right now because I feel like when I listen to podcasts, I start to like love a guest, which I am loving this, and I want to pause and go like look you up. So what is your Instagram?
It's rachel.mandelbaum.md.
Awesome, and that will be in the show notes as well. But okay, I got it
Um,
on your Instagram.
but so it's a small little quarter-sized device. You can think of it like if you've seen people wearing a glucose monitor on the back of their arm, that kind of
Yeah.
a thing. It's the same size. You wear it on your abdomen throughout the duration of your IVF cycle. And then basically medications just plug right into it. So they're the same medications, and you're just sparing yourself the injections and kind of the needle pokes at home.
Okay, educate me because I have always wondered this because I know it's like this whole like new thing where people are wearing those monitors on the back of their
Mhm.
arms to eat and understand like their glucose spikes.
Yeah.
It's like very like health fad right now. I always wondered like, is there a needle that's like how it's not just like sticking on your stomach, is it?
So, no, there's a small device that's underneath your skin, and it
Okay.
depends, depending on the device, whether it's a tiny little like metal microneedle that most people can't really feel,
Yeah.
or in this case, it's not metal. It's a tiny little plastic cannula that sits right under the skin, and you can think of it like a microscopic little IV that's just right under the skin,
Yeah.
right?
And the physician is putting is in I want to say installing it, but is the physician putting it on or is the patient?
So you can do it either way. I have my team put it on for patients because I
Yeah.
think that that's part of the
Part of
luxury
taking
of this is that
yes.
like you're taking out a lot
Most of
of
anything.
needing to do things on yourself, but it is designed for patients to put it on themselves. So it's really it just inserts with a push of a button, like the
Yeah.
same if you watch a video of someone putting on a glucose monitor.
And I know I've heard like all of the people doing like the glucose monitor on the back just for like I don't want to say funsies, but just for like to better their health. People are like, yeah, this is way worth it. Like it's not
Yeah,
painful.
it's like you feel a millisecond of like a little pinch when you put it on. But I put
Which
them
is
on
tenfold less
probably
than
once a week to show people, and
yeah,
it's like less than an injection.
yeah.
It's very simple and quick. And then yeah, all the medications go through it. That includes the trigger at the end. So it's easy. It's really easy. And all the we just adapt the medications for it, and then patients don't have to do injections. So in my practice, like 70% of my patients use it at this point, and
70?
yeah. And I think it's really for the right patient. Like there are going to be people who are like, I don't mind injections. So like why would I wear something every day? And that's very true. But I think that it is just another option that allows people who injections would have caused a lot of stress and anxiety
Yeah.
to make it through this
Well,
process.
and we haven't really mentioned or talked about like the times you have to give the injection. Like maybe you're at work in the middle of a meeting, or maybe you're like in the car. I mean, I just feel like that has to be so much easier than filling up a syringe, finding like your little cloth to wipe off your skin, do it. It just seems like it takes away, like we started the podcast, like you as a patient identified a ton of gaps in the process and like doing these like repetitive injections every day during the process was one of those. That's really cool.
Yeah, and I think, where I think we are in the field of IVF and fertility treatment is this is new, right? Like IVF hasn't been around for, a century. It's a newer field. And so I think the earlier, years of IVF were really about trying to get people pregnant, trying to make our success rates, as good as they can possibly be. And now I think we need to kind of back up and say, okay, we're really good at IVF and we can get a lot of people pregnant and, have moved the needle on this field, so much in the past couple decades. And now we need to focus on making this process more palatable for patients.
I love it. I think probably one of the biggest questions listeners are thinking of is, can I get this in my clinic? Or do I have to go out to California? Do you know of any other clinics doing needle-free IVF, or what would you kind of
So
recommend to
we're
patients?
we're we're the only ones I know of right now. There's a couple others that have adopted it, but I'm working on it. I'm working. There's a couple different avenues that I'm hoping to get this into clinics, and so stay tuned. My hope is that within the year we can make this really accessible for patients.
I'm really excited. Before we go into some like rapid fire, just fertility based questions, I promise they're easy. Do you want to share anything else about kind of I think we covered everything. But if you want to share anything else other than I think you share a lot on your Instagram.
Yeah, I share a lot of videos of myself doing it, kind of just a lot of FAQs. But yeah, I mean, I think, my patients are really happy with it. It again is just another option. It's not for everybody. And certainly, I think if patients don't feel any anxiety with injections, then, that's definitely
Yeah.
easier because you don't have to wear something all the time. But I just think, as we talk about holistically, right, stress is part of it. And
Yes.
so I think anything that we can do to minimize stress in this process is well worth it.
Okay, we are so connected. That was my first rapid fire question. Does stress cause infertility? I know that that is like a very like blanket statement that gets out there a lot. You hear from people that aren't doing infertility treatment like just relax, don't stress. But what is your take on that statement? Does we are so very connected. That was right into my rapid fire question. We have four. I think I'll ask you all of them. But what is your thought on does stress cause or not cause? Yep. Does stress cause infertility?
So the answer is yes and no, right? We know that our bodies actually, in times of extreme stress, right, what they're designed to do is to shut down fertility, right? To say, okay, you are in a period of so much stress that we don't want to get pregnant and sustain, growing another life,
Yeah.
right? And we see this in times of like starvation, right? Some women who are training for like marathons or ultra athletes, your body perceives this malnutrition and this stress and shuts down ovulation, right? And we see that as not getting a period or skipping
Yeah.
periods. Now, some women's set point might be different than others. And some women's body may erroneously perceive stress and shut down ovulation. Now, the question though becomes, okay, if somebody's ovulating, right, that's extreme stress, right? And we know that mechanism of shutting down ovulation. Now, the question becomes, okay, for everyday stressors, right? Yes, there will be some people whose bodies perceive that and they're noticing irregular periods, and that's a different story. But the question is, do these stressors in our everyday life and cortisol levels and all of that impact fertility? And, it's a very difficult thing actually to show in a research perspective, from a research
Right.
lens,
It's like
because
so uncontrolled.
well, it's uncontrolled and everybody perceives stress differently, right? There's some people who, like, there's not a good scale to look at it. Not even cortisol levels correlate that much with how much perceived stress versus, what our bodies perceive. So I think the answer is yes. Like, we know stress affects fertility and fertility outcomes, but how we measure it is very inconsistent. And I think that, um, a lot of how stress impacts fertility can be addressed through fertility treatments, but we should go to great lengths to try to reduce stress, right? Patients always ask me, around the time of, embryo transfer, okay, if this is a really stressful period in work, should I delay? And I think that's where it becomes really hard and really nuanced, and you have to work on,
Right.
an individual level to really talk with a patient, okay, how can we improve this? Should we make these decisions? So I think the answer to the blanket statement is yes, like stress does affect fertility. To what degree and for every individual person, that's where I think you have to talk to your doctor and really see, okay, in what ways is it impacting fertility? Certainly it impacts general inflammation and cortisol influences, our immune system and all of it. So yes, it impacts, but to what degree is really an individual question.
I love that. And I think when people ask me all the time, like, would you recommend acupuncture? I'm like, well, yeah, because I think just as an overall, acupuncture is going to decrease your stress because you're sitting in a room by yourself for 30 minutes to an hour, just like decompressing, and you don't have all these factors. So I love that answer. I feel like I haven't really heard that before. So thank you. All right, three more.
Yeah.
Do you think fertility supplements are worth it?
So yes, but I think it comes with some important caveats, right? So the question always is, I think, social media markets us a laundry list of supplements, and you can find all these books that you could literally fill a whole kitchen cabinet worth of supplements. And so I think the important thing is, like, what are we actually addressing with supplements? Like, from a scientific perspective, what are the actual mechanisms that we're addressing, right? And it's also really important to understand, like, what can we not overcome with supplements, right? Supplements are not this magic band-aid that fix the impact of age on fertility, right? Like, if you're 40, yes, I recommend to be on supplements, but it doesn't erase the fact that your eggs have been in your ovaries for 40 years, right?
Right.
And so it just requires, a a perspective that, includes supplements. And I don't think it needs to be this huge laundry list of supplements, because I think a lot of them work in the same way, right?
Mm-hmm.
So that's where I really work with patients to say, okay, you're on coenzyme Q10, and how is that impacting, on a cellular level, the eggs? And then what are we going to add to that, right? Because that might be doing the job already of a lot of other supplements, right?
I love that you said that. That was the one that came to mind. I'm like CoQ10, maybe vitamin D, and like
Right.
that. I feel like when you read, I think like probably all these fertility patients now are reading like starts with an egg, and it's good, but it can be so overwhelming. And like you're just like highlighting, okay, do buy this, buy this, buy this, and like not to mention where you get your supplements from too. Like
Yes.
you just get them
So
on Amazon and just like go, go, go? Or are you going to like really legitimate sites and getting less but more quality?
totally. And I think you can't minimize that taking supplements requires a lot of energy, that physically supplements can have side effects. Like I see
Yes.
all these people who, are nauseous after their supplements,
Yeah.
or they're causing, other side effects. And so really you have to look at what are the downsides of the supplements you're taking. And also, as you pointed out, the supplement industry is not regulated, right?
Mhm.
So, really making sure that you're getting supplements from a reputable source that is doing third party testing, making sure what's in it, what you think is in it, is actually in it.
Yeah.
Um, so, yeah, I think supplements are important, and they're definitely part of what I recommend to patients. But I don't think people need to be on a laundry list of supplements. I think a few important ones that are really targeting, mitochondrial function,
Mhm.
cellular energy, antioxidants, protecting cells from oxidative damage, those are great. Um, but I also have to remember, like, I can't take a supplement daily if somebody paid me to. I had so much trouble
Oh
just
no.
taking a
I
prenatal
I
vitamin.
couldn't even take the
I
prenatal
took
because I was so
gummies.
sick. Yeah.
So I don't think that it's this, like, again, magic band-aid that everybody has to do. I think you can meet success without supplements. But I think if you're like an either or, then yes, I think it makes a small amount of difference. And again, like we talked about before, those small amounts of difference add up.
Yeah.
And that could be, if it's not in supplements, that could also be in like changing your sleep regimen, or,
Yes.
you know, I
Or
don't,
like for
I
me,
don't,
like drinking more water. Like it's just
yeah,
like the most basic stuff. Like I finally ended up having success after 6 losses on my seventh pregnancy, and I'm like, what did I do different? Okay, I drink a ton of water. I like went from crazy hit training to more a little bit. There was a lot of lifestyle changes for me that I feel like really impacted my success.
yeah, definitely.
Last question. We had another one, but I feel like you already touched on it. Okay, last one. Is there a best age for egg freezing?
So this is a very good question, and I think you will never find a fertility specialist that will tell you put off egg freezing, right? Um, I think the first question is like, who should do egg freezing, right? And I definitely don't put the blanket statement on everybody should, right? The main questions are you going to be trying to conceive a family in your mid to late 30s, potentially early 40s? And that doesn't have to be your first baby. That could be your second, third, or maybe baby you didn't even know you wanted, right? So
Mhm.
definitely just for options. And then if the and or also if you have like any other medical conditions or anything that may impact your fertility, right? Certainly. And so the
Yeah.
question becomes, okay, are you someone who will definitely want frozen eggs, right? Or frozen embryos? And if the answer is yes there, then earlier the better, right? I think where, there's a lot of people who say, okay, wait, it's just to see what are your life circumstances, right? If somebody is completing their entire family before the age of 35, then, um, and I guess you can say, okay, well, do we know what, we wanted, 7 years ago? Maybe
Right.
yes, egg freezing is wonderful for leaving options open. But, the question is, okay, what's the risk that that person would need IVF? And if they go through IVF and this depends on the individual person and what their egg count is, but the question is, if they are to need IVF at 33, right?
Hmm.
Then their outcomes would still be pretty good, right? Going and doing IVF at that
Yeah.
age. So I think the answer is earlier the better, right? In terms of frozen eggs, we know that for most people, and I say most because it's not for everybody, that rate of change is flatter before the age of about 34, 35. But again, if you're someone who wants frozen eggs earlier, the better. Nothing ever improves with aging and time in terms of our fertility. And just as soon as it fits in your life, right? I mean, I think we all know this is an expensive process. It's a lot to go through. And, I think the earlier we do it, really the more bang for our buck, so to speak, we get. It becomes really hard to freeze enough eggs when we're in our late 30s, early 40s, that we have this really high chance of success.
Awesome. Well, I know you have an egg retrieval to get to, so I'm going to give you like 15 minutes to decompress before you do that. Thank you so much for being on with us. I think last thing, where can listeners find you? I know on social media and websites would love to hear that. And just to reiterate, all of the Needle Free IVF information is on your Instagram.
Yes. So please find me on Instagram. It's rachel.mandelbaum.md. And I love engaging with people about your experiences and even if you have questions about needle-free IVF, send them my way.
Thank you so much.
Thanks for having me.